Welcome. It's my distinct pleasure to introduce the recipient of the Alliance for Aging Research's Claude Pepper Award for Advancing Healthy Aging. The Claude Pepper Award for Advancing Healthy Aging was established to honor a Democratic member of Congress who is leading the way for policies encouraging medical research, innovation, and care to benefit Americans as they grow older. Supported by the Claude Pepper Foundation, this award is named for the Honorable Claude Pepper, who fought tirelessly in both the U.S. Senate and House of Representatives to help those in need. As chair of the House Select Committee on Aging, he sought to strengthen programs for older adult and disabled Americans, including Social Security, Medicare, and Medicaid. Through the Claude Pepper Foundation, the Pepper Institute, and Pepper Centers at Florida State University, the Congressman's legacy lives on and is dedicated to research on aging and alternatives to long-term care. This year's recipient of the Claude Pepper Award is House Energy and Commerce Committee Chairman Frank Pallone, Jr. Chairman Pallone has been advocating for older Americans' health and financial security for more than 35 years, since his days in the New Jersey State Senate. Chairman Pallone has led the way for some of the most significant improvements in the Medicare and Medicaid programs and championed research at the National Institute of Health and clinical developments at the FDA, all of which the Alliance for Aging has been honored to help support. The Affordable Care Act has done so much for Americans by launching free preventive care for older adults, closing the Part D coverage gap, and introducing coordinated care to improve healthy aging. Chairman Pallone has led the efforts in the House to defend and strengthen this landmark law. His 21st Century Cures Act increased funding for NIH and helped accelerate patient-centered medical product development at the FDA. He has also guided reauthorization of the FDA user fee program, which has become increasingly vital to the FDA's ability to accomplish its mission of bringing safe and effective medical products to older adults and Americans. Chairman Pallone, it is an honor to be with you and to present with you the Claude Pepper Award for Advancing Healthy Aging.
Well, thank you so much, Tom. And I think you can see the award here. It's very pretty, green and blue. Throughout my career, I've kind of used the green and the blue in our campaigns because green is, was the color of so many things here at the Jersey Shore, and of course the ocean with the blue. So it's really nice. It's a very pretty award, and I thank you for that. I also wanted to say too that, well, of course I knew you, Tom, as the staff director for the Rules Committee because Claude Pepper was the chairman of the Rules Committee for so many years. But at the same time, as you know, he was the chair of the Select Committee on Aging. And when I first decided to run for Congress in 1988, he was still, I think it was his last year. And I remember going to the Atlanta convention and looking for him because I chaired the Aging Committee in the state Senate. And I wanted to get his support. And he was great. We met. I had some time to spend with him. I don't know, I think he may have even written me a check, actually. But in any case, he was very supportive. And then when I went to Congress the next year, I think it was Lucille Roybal Allard's father who was his successor. And right. I approached him, and Claude Pepper asked him to put me on the Aging Committee. And so I was on that committee as well.
Well, that's wonderful. So now's the time when I ask you a few questions. You mentioned earlier about Claude Pepper being chairman of the Aging Committee and your being chairman of the Aging Committee. When he started, he was already in his 80s when he was chairman of the Aging Committee. But although you are still a relatively young man, when you started, you were a baby compared to Claude Pepper. So what got you interested in wanting to work on aging issues back in the New Jersey Senate?
Well, I had a large number of seniors in my district, still do, of course. So there was that factor. I mean, there was a political factor because I wanted to get reelected. But also, when I graduated from law school, I worked part-time for an agency called Protective Services for the Elderly. And it was basically a nonprofit that provided what would you call like a guardianship and conservatorship
Mhm.
services. You know, there still is, and it was basically responding mostly to financial abuse, like where a senior citizen, either by a friend or a family member, was being financially abused, you know, taking their money, whatever. And so, that agency had a part-time lawyer, that was me, and we would, try to protect seniors from that kind of fraud and abuse. And then sometimes I would have to go in and have a conservator appointed for their finances, or a guardian for, you know, dependent on the situation. And and then when I was elected to the state senate, it was interesting. I was like but for me, the Democrats wouldn't have had a majority. Like, we had a majority of one or two, I don't remember exactly. And I was 35. It was a minimum age. You had, oh, maybe 30. I think you had to be 30 in order to be a senator, right? There was an age thing.
Yeah.
And so I was the youngest. But the leadership in the state senate, the Democratic leadership, was very concerned about my seat. And they knew there were a lot of seniors. So I asked, well, could I chair the aging committee? And they said yes. And then what we did is we passed a bill that essentially set up a public guardian, very similar to what I did before, statewide. That was a state function. That was a bill. We also did a bill on Alzheimer's daycare to provide for that. And we also did a bill on the continuing care retirement communities. You call them lifetime communities, where you buy into it and you get like personal attendant, you get your housing, but you also get personal attendant. And then if you need the nursing home care, there's that element. And we did a bill regulating that, because there was a lot of financial abuse with those systems initially. They were not well financed and they went bankrupt. So I was very interested in all those issues when I met Claude Pepper.
Well, that's great. Well, listen, as we wrap up, let me ask you this question. As you approach aging, because you look fantastic and you...
Well, it's very deceiving.
And I know that you have an extremely active schedule, both in DC and, of course, back home. But what does healthy aging mean to you? How would one sort of prepare as they think about going into sort of that stage of their lives?
Well, I'm not a very good example, because I'm not, very active physically, unfortunately. But I mean, it obviously, things like being active physically, bicycling, walking, where I live is right near the ocean. So you see all kinds of people my age or older, walking on the boardwalk, bicycling to try to keep fit. But I'm not. But one of the things that I did do, though, a couple years ago, because I'm 68 now, and I became conscious of it when I turned 65, right, was to try to trim down. In other words, I've lost maybe like 20 pounds or so over the last year or two. It was a pretty gradual thing. So, those are the most important things, I think. But it's also to be active. Now, of course, being in Congress is not, maybe you shouldn't even be asking me this question, Tom, because, being in Congress is incredibly stressful, particularly now during COVID. So I don't know if I'm a very good example. But I mean, it's obviously you have to stay active, physically, mentally, otherwise, and be involved in the community. I think all those things are very important.
Well, that's excellent. That's excellent. Well, Mr. Chairman, thanks so much, and congratulations on this much-deserved award. We wish you continued success in your representation of New Jersey's 6th Congressional District, and of course, your work to better the health and well-being of Americans. So thank you so much for being with us.
Well, thank you, Tom, and thank you for this wonderful award.
You deserve it.